Hello, my name is Tracey Piper. I am a cognitive behavioural hypnotherapist and predominantly work with individuals that are experiencing stress and or suffering with anxiety. I'm also a member of the Alpha family, so understand what it is like to have Alpha. During the presentation, I will provide an overview of my Alpha journey, starting with my Alpha family tree through to diagnosis and living with the disease, as this might resonate with other Alphas, particularly those that have recently been diagnosed, albeit everyone's experience is unique to them. I will then introduce the concept of cognitive behavioural therapy and how this can be used to help deal with stress and anxiety. As the presentation is time limited, I have paid particular attention to thoughts and have included a short practical exercise designed to help you identify thoughts, acknowledge them, and release them instead of getting caught up in them, which in turn will help to reduce their emotional impact. My introduction to Alpha, and indeed this group, was through my dad, who was diagnosed as SZ in 2007. Sadly, he died aged 70 in 2018. As the disease progressed, he was diagnosed with further Alpha-related conditions, including emphysema, COPD, and panniculitis, alongside other health conditions. For the last 10 years of his life, he was on oxygen 24/7. Shortly after Dad's diagnosis, Mum was also tested, and she was diagnosed as MZ. She is also lung affected, has emphysema, COPD, and other health issues, but thankfully is still with us. Given that both of my parents had the Alpha gene, I was provided with the option to be tested also, along with my two siblings, both of whom declined. Personally though, I needed to know. I had observed the decline in my dad's health and how it had impacted on Mum too, so I wanted to know what was in store for me. Nothing, however, prepared me for the results, which turned out to be ZZ. I will talk a little bit more about that later. Following diagnosis, I participated in the ADAPT programme to learn more about the disease and also to obtain regular updates and how it was affecting me from a health perspective. By the time I was diagnosed, I already had 2 boys and was concerned what this meant for them too. Fortunately, their father's test results came back as normal, and at the time the letter confirmed that they had partial deficiency, MZ. Fortunately, both remain fit and well. So in summary, not only do I have Alpha and have lived with it since my diagnosis in 2009, I have also experienced living with other Alphas and the impact that Alpha has had and continues to have on their lives too. Thankfully, I consider myself to be extremely lucky in terms of my current health compared to some other Alphas in the group. Once I'd come to terms with my diagnosis, I was able to make informed decisions about lifestyle choices to give me the best possible chance to do what I could to preserve my health. Both children are also well and make informed decisions to preserve their health as best they can too. Moving on to managing stress and anxiety whilst living with Alpha. As we know, living with Alpha can be challenging, both physically and emotionally, and it can, and often does, certainly based on my experience, have a significant impact on mental health and well-being. In fact, in 2019, a paper was published entitled Anxiety and Depression in Patients with Alpha-1 Antitrypsin Deficiency, Current Insights and Impact on Quality of Life. The paper concluded that anxiety and depression are common and underappreciated comorbidities in the alpha population. The paper also made reference to the Big Fat Reference Guide, written by AATD affected individuals for AATD individuals and families. This includes a section on coping with Alpha-1, which acknowledges the stress of diagnosis and the disease process. The paper also proposed ongoing studies regarding the influence of anxiety and depression on patient-centered outcomes. Unfortunately, however, I have been unable to locate any follow-up studies into this subject area. As mentioned previously, addressing mental health can have a positive impact on overall well-being. Trained therapists can teach you how to handle the challenges and uncertainties that come with alpha, of which there can be many. Teach you effective ways to manage anxiety, depression, and other emotional difficulties that may arise either as a result of alpha or more generally in life, using evidence-based approaches. Help you to build resilience and adapt to physical limitations, lifestyle changes that may arise as the disease progresses. In summary, addressing mental health helps alphas to develop a more positive outlook, improve self-esteem, and maintain a sense of control over the things that they can control in their lives. Okay, back to diagnosis. As mentioned previously, given the circumstances and also the type of person that I am, when presented with the option to be tested, I just needed to know. Nothing, however, prepared me for what came thereafter. I went along for the tests, but in the back of my mind I thought I will be fine, as I have always had really good health. At the time of testing, I wasn't offered any form of counselling, and in fact, when I first mentioned alpha to my GP in 2009, she hadn't even heard of it, and neither had anyone else in the practice. From what I understand, this is still a common issue today. The results arrived by letter, and there it was staring me in the face, the words set out on the screen. Your recent tests for Alpha-1 Antitrypsin Deficiency confirm that you have the common severe form of deficiency, PZ. All at once, everything changed. I was in shock. Not only did I have alpha, but I was ZZ. This was worse than SZ, which Dad had got, and he was really unwell from his mid-50s. I saw it as a life sentence, knowing that from that point forward, my life could change significantly, and with that, I experienced a whole raft of emotions. So how did you feel when you were diagnosed with alpha? Were you stunned, scared, angry, upset, confused, anxious, fearful? I was certainly all of those things. Alternatively, you might have felt relieved. With my dad, he had spent a long time and undergone many tests trying to get to the bottom of what was the matter with him. Obviously for him in part, yes, there was relief, as eventually he had answers as to why he felt the way he did, but on the other hand, he too went through similar emotions. One other emotion not reflected on the slide is guilt. Speaking to my mum, she stated that when I was diagnosed, both she and Dad felt guilty because they had passed the genes on to me. Obviously it wasn't their fault, but it was an emotion they experienced all the same, and likewise I too was concerned for my children. So don't be surprised if you experience similar emotions, as this is a perfectly normal reaction. Your response may be similar to those experienced a significant life event, such as those listed, hence the reason that I have included the 5 stages of grief, which may or may not be applicable to you as you come to terms with your diagnosis. Even contemplating a future loss can provoke profound feelings. So for me, at 37, I felt like I had been given a life sentence and that I had been robbed of a healthy future through no fault of my own. Also, remember that people who love you and care for you will be going through the same process too, but from a slightly different perspective. They will be conscious of the impact that it is having on you as you come to terms with the diagnosis and will want to support you, but they will also be thinking through what it means for them too. So looking at diagnosis and life thereafter. As mentioned earlier, anxiety can be triggered by a significant life event, such as a diagnosis of a medical condition, like Alpha. What can you do to help alleviate this? One thing that my dad did was find out as much as he could about the condition and also became actively involved in the group and made many friends. It was great to see that he had a purpose and passion again. So why not follow in his footsteps? Decide what it is that you need to know, write a list of questions and get curious and go find the answer. Listed on the slide is some of the questions that I had at the time that I was diagnosed, but you might have some which are more specific to you, particularly if you are lung or liver affected or have developed other alpha-related conditions. Thankfully, there is a lot of material available now on the Alpha-1 UK support group page on the internet or via the Facebook community. Karen and other members of the committee are extremely knowledgeable in the subject area and provide invaluable support both to newly diagnosed members and also those living with the condition. The Facebook page is very active and people are very supportive, regularly posting queries and concerns on there, and also updates regarding trials and such like for the Alpha community. So if you aren't already a member of the Facebook page, sign up if you can. I thought the Serenity Prayer was particularly apt given the subject of the presentation and have highlighted the words which I consider most relevant in this regard. So, grant me the serenity to accept the things I cannot change. If you have Alpha, accept it, as there is nothing you can do about it. Going on, courage to change the things I can. We will touch on this later. And wisdom to know the difference. And this is the most important thing to focus on, the things that we can change and not those that we can't. Moving nicely into the approach that I use when working with individuals to help them overcome stress and manage anxiety using cognitive behavioural therapy. CBT, as it is commonly referred to, is based on the concept that our thoughts, feelings and emotions, physical sensations and actions are interconnected, and that negative thoughts and feelings can trap you in a negative, vicious cycle. So it is not necessarily the situation that causes the emotional distress, but your interpretation of it that results in the distress. It can help you manage your problems by changing the way that you think and behave, and by breaking the cycle at any point. It deals with current problems and issues and your future primarily, but not forgetting the problem's origins. So we don't necessarily need to delve into the past. It teaches you how to recognise and challenge negative thoughts and change unhelpful behaviours. It can help you cope better with your physical symptoms. It can also help with pain management too. It is recognised by the NHS as an effective way of treating anxiety and depression, as well as a number of other health-related conditions. As a trained cognitive behavioural hypnotherapist, I combine CBT with evidence-based clinical hypnotherapy, which includes hypnosis, and this has proven to be more effective than using either method alone. So referring back to the Serenity Prayer now. When looking at the cause of stress and anxiety, it is important to understand the triggers and whether these are inside or outside of your control. For the purpose of this presentation, I would also add alpha or any other medical diagnosis to one of the factors that are outside of your control. If it is outside of your control, there is very little you can do about it, other than perhaps dampen the effect by turning down the emotional dial, which is one of the techniques used in hypnotherapy. If, however, it is within your control, such as those areas listed, you can do something about it. For example, my boundaries. Are you a problem thief, pinching problems off other people to solve for them and shouldering the responsibility and burden at your own expense? The goals that you set, are they realistic, or are you trying to do too much or be a perfectionist? How you speak to yourself, including internal dialogue, your thoughts. Are you kind to yourself? Would you talk to your best friend in the same way as you talk to yourself? As mentioned earlier, the area that we're going to delve a little bit deeper into later is thoughts. But in the meantime, it is worth re-emphasising that all of the factors and triggers that cause anxiety, that fall within your control, you can make a plan and do something different about those. So turning now to the vicious cycle. It is widely accepted that our life experiences shape who we are, including our core values and beliefs, our underlying assumptions, which in turn influence our thoughts. In most cases that is fine, so a simple example of a life experience would be learning how to ride a bike or drive a car. After a bit of training and practice, most of us get the hang of this, and once we've learnt the skill, we tend to remember it, and once it becomes habitual, we don't even have to think about it. It happens automatically. Let us think about this as a little computer program running in the background. Unfortunately, however, this can also happen with anxiety-provoking situations. A good example of this would be fears and phobias. E.g., if a child was bitten by a dog, this could result in a fear of dogs later in life if the mind stores this experience as a fearful event resulting in harm. When the child/adult thinks about coming into contact with a dog thereafter, the mind will automatically recall what happened before, the little computer program running in the background. The more frequent the program is run, the stronger it becomes and reinforces the fact, which it is at that point, that dogs are something to be feared. So let us consider that using the vicious cycle. The diagram on the left captures the situation, so using the earlier example, this could be the dog barking. It would be classed as an external stimuli, environmental, rather than an internal stimuli, which could be a thought. So in CBT, we look at the thought, what was going through the mind, the emotions, what were you feeling, sad, anxious, scared, bodily sensations, how did this translate what was going off in your body from a physiological perspective, and finally behaviour, what did you do, how did you react. Now let us map the case example involving the dog onto the vicious cycle of anxiety captured on the right. As mentioned previously, the situation or stimuli is a dog barking, so it's an environmental factor. Regarding the thought, it could start with, oh, there is a dog close by. And the chain of thoughts that follow could be, it will bite me, I need to get away, this is really bad, I don't want to be bitten again. By now, the automatic computer program is running and the anxiety has already been triggered. As a result, there is an increased scanning for danger and physical symptoms intensify, for example, heart beating faster, so it's a fight or flight response. Also, the attention narrows and shifts to the self. As a result, action is taken, which usually results in escape or avoidance, so for example, run away. In the short term, it provides relief, but in the long term, it reinforces the fact that the dog is something to be feared, which in turn makes the phobia worse, e.g., increase in physical symptoms, worry, loss of confidence about ability to cope in that situation, and increased use of safety behaviours, so running away. And it's not all in your head. As mentioned previously, it feels very real. You can feel it in your body. Looking at the diagram on the left to start with the stress response at the top, we have the hypothalamus and the amygdala. They form part of the limbic system. Amongst other things, they are responsible for processing and regulating emotions, forming and storing memories and learning. They also inform behaviours, keep us motivated, and form an important element of managing the body's response to stress as it connects to the automatic nervous system, which manages our unconscious processes such as our heart rate, blood pressure, body temperature, etc. The function of the hypothalamus, often referred to as the command centre, is to maintain homeostasis, which is a steady internal state. It produces hormones, helps you sleep, manages your mood, hunger, thirst, blood pressure, body temperature, heart rate. It also has a role in controlling the body's response to stress. The amygdala controls our emotional responses including how we experience emotions and feelings like anxiety, anger and fear, memory and social interpretations, so that's information about others. This area is also key for the formation of new memories and interacts with the hippocampus by attaching emotional content to memories, hence the reason that memories with strong emotional content tend to stick. Fear learning is also part of the amygdala, so the example of the dog is something that could be considered there. In fact, fearful memories can be formed after only a few repetitions, which can result in avoidance of certain fearful stimuli and is linked with the fight or flight response as a stimulating activity, which can influence the body's automatic fear response. So once the stress response has been activated, the sympathetic side of the autonomic nervous system is triggered. This is often referred to as fight or flight. So we have this on the left hand side here of the screen. So once the fight or flight state has been triggered, you start to experience physiological changes in the body, such as those listed here. Once the threat or perceived threat is over, the parasympathetic side of the nervous system, which is often referred to as rest and digest, here, is brought into play, and that returns the body to its pre-stress state, homeostasis, which we mentioned earlier. The diagram on the right captures some of the points already discussed. The other point worthy of note is that at the point the stress response is triggered, the prefrontal cortex is also triggered too. This is involved in logical thinking and rationalising, and therefore, because that becomes affected, it can make it difficult for us to concentrate when the body is stressed or anxious. The final comment is that the stress response is triggered. It bypasses rational thought, triggering the emotional response. So that's the little computer program that we've referred to earlier, running in the background, and this all happens without our awareness. So dealing with the consequences. So I usually introduce relaxation strategies as a companion to exposure and cognitive skills, but not necessarily as a replacement for them. Sometimes using relaxation techniques, as mentioned on the top line here, can actually make anxiety worse in the long run. Why? Because sometimes relaxation strategies are used as a way to get rid of anxiety when we are in distress. Trying to get rid of something trains our brain to see it as bad. So we teach the brain to set off the anxiety alarm even louder when the anxiety presents itself. In the long run, this can make the anxiety worse. So in short, there are times and places when to use relaxation skills. So you can use them as a daily practice, a little like exercise, to lower tension and feel calmer in your body, and that will work over time. During times of distress, in order to prevent avoidance of something that is integral to our life aims. Why? Because it is more assertive. Doing this exercise will not cure anxiety, but it will keep you from avoiding a situation. So when we face anxiety, the brain learns that it is not so dangerous, which in turn lowers the anxiety in the long run. So when not to use relaxation strategies. So in times of panic or severe distress, as a way to get rid of anxiety. As a replacement for other types of CBT skills, such as cognitive restructuring or exposures. Why? Because it is overprotective and this anxiety is unbearable. This trains in the idea further that anxiety is dangerous, which causes more anxiety over time. Included below are some of the examples in my guide, which I will share with members of my Alpha family on request. So, in summary, although relaxation strategies can be useful in reducing general levels of anxiety and tension over time, they are not typically a cure for anxiety. They are best used together with other CBT skills such as cognitive restructuring and exposure, and practice regularly like exercise. They should not be used to prevent or get rid of panic or severe anxiety symptoms. For each person, there is a different set of activities and skills that help them relax. So our best strategy is to find the ones that work for us and practice them. So back to our thoughts. We all see things differently. As mentioned previously, we are all unique and see things based on our beliefs, values, and experiences. Therefore, it is not necessarily the situation that is the problem. It is the way we interpret it and think about it. What do you see? So I'll just give you a little moment here to have a look at what you can see. There are two actual images displayed. Okay, so the first one that I will point out is the little doggy. You can see him here. Or alternatively, the boy with the rucksack on his back, running away with his back to us. You might have already seen this one. So again, two images displayed. Okay, so you've got the young girl here and you've got the elderly lady here, and this is her smile and her eye. And finally, two images displayed. Okay, so you've got the duck when you look at it facing to the left, and then you have the rabbit facing to the right. Okay, so these are just a few examples, some of which you might have already seen, and I'm sure you will come across many more. But another example might be that you are having a conversation with somebody and you just cannot see something from their point of view, and likewise they cannot see your point of view. It doesn't mean to say that either one of you is wrong, but you just can't see it from each other's perspective. So you might have in the past have agreed to disagree on that particular occasion, but sometimes that can demonstrate lack of cognitive flexibility, which we'll touch on next. Okay, so what is cognitive flexibility? So as we interact with one another, our brain just wants to grab information now, but in doing so we apply our own filter, again based on our own experiences, values, beliefs, etc., and then have a hard time of letting go of that information or that thought. This can often make the brain feel inflexible. So when working with anxious individuals, I find that they often make quick decisions and have difficulty letting go or exercising cognitive flexibility, which makes it difficult for them to view things from an alternate perspective. The little computer program whirs in the background, translating their thoughts into emotions, physiological feelings and behaviours, and in turn the program gets stronger and stronger unless we break the cycle. So, most people have an internal monologue, which we refer to as thoughts or self-talk. However, you are not your thought. Included below is an example of a thought from someone who was suffering with anxiety. By breaking the thought down and capturing it diagrammatically, they were able to see that they were not their thought, rather than just accept it as true and allow it to run in the background without challenge. So breaking it down, I am letting people down. I am having a thought that I am letting people down. And then finally, I notice that I am having a thought that I am letting people down. You are not your thought. It is just a thought. Recognize it, acknowledge it, and let it go. The next slide refers to leaves on the stream. This is a really nice exercise which helps you to separate yourself from your thought. Step back, observe without judgment, and let the thought go. It guides you to let go of the thought rather than getting sucked into it. And with a little training, you can quickly learn how to observe your thought, acknowledge it, and let it go. This is referred to as cognitive diffusion, which promotes psychological flexibility. And now we'll move into the exercise. So sitting comfortably, I would now like to invite you to close your eyes. Place your feet flat on the floor and adjust the position of your body so that you feel as comfortable as you can possibly feel at this point in time. When you are ready, take a nice deep breath in to a level which is comfortable for you, gathering up any tension that you feel within your body as you do so. Good. And after a few moments, exhale slowly and relax. Remember, this time here is just for you. You have nothing else to do other than concentrate on my voice. If your mind wanders off, that is perfectly normal. Just bring your attention back to my voice. And now, as you settle into a comfortable, relaxed position, breathing easily, just notice the sensations in your body. How it feels to have your feet flat on the floor. Notice the weight of them. Notice the sensations in your left leg. Notice your right leg. And in a few words in your head, just say, I notice my leg. Notice your back on the chair. Notice the sensations of the pressure of your back on the chair. If your mind wanders off, thinking of things that happened yesterday or may happen tomorrow, just bring it back now to the sensation of sitting in the chair. Notice your front, your arms, your hands, your fingers. Notice the sensations in them. Notice if you are relaxed in your body or if you are holding tension. Notice any sensations in your body now. Now, notice your shoulders, your neck, your head. Notice what sensations are there in the whole of your body, resting as it is on the chair. And now, as you finally focus on the sensations in your body, just allow any sensations or tensions to let go with the next breath that you take, and just relax as you release those sensations and tensions from the body. Good. I would now like you to imagine that you are sitting or standing beside a gentle flowing stream or river with leaves floating along the surface of the water. Imagine, if you will, that you are sitting on a soft grassy green bank overlooking the stream or river which is flowing gently in front of you. It is a beautiful summer's day, and you feel the gentle breeze across your shoulders as you focus on the stream or river. The soft, fragrant smell of wildflowers drifts by whilst you're sitting on the comfortable bank resting. You then become aware of trees on the other side of the stream or river. And as you focus on the trees, you notice that leaves are falling and have fallen into the water. Notice how the leaves swirl through the air before they hit the water. Notice the different colours and their varied shapes. Notice how they bob under the surface. Watch them for a while and see how they move on the stream or river and how they move along the water out of sight. For the next few moments, take each thought that enters your mind, distance from it, and place it on a leaf, and simply let it float by. Do this with each thought, pleasurable, painful, or neutral. Even if you have joyous or enthusiastic thoughts, just become aware of them, step back from them, place them on a leaf, and let them float by. Good. Just give you a few moments to do that now. If your thoughts momentarily cease, then just continue to watch the stream. Sooner or later, thoughts will tend to start up again. Allow the stream or river to flow at its own pace. There is no need to speed it up and rush the thoughts along. You are not trying to rush the leaves along, or get rid of thoughts, or have an empty mind and perfect concentration. You are simply allowing your thoughts to come and go at their own pace and give them no particular attention. If your mind says, I cannot do this, I have this, I am bored, I am not doing this right, then simply step back from those thoughts, detach from them, and place those thoughts on the leaves too, and let them pass by. It does not really matter what the thoughts are. All that matters is that you can separate the thoughts. See the thoughts as they appear in your head, and as they appear, let them float out and land on a leaf. From time to time, a leaf or thought may get stuck. Allow it to hang around until it is ready to float by again. This is entirely normal, and just as soon as you realise that you've wandered into your thoughts, acknowledge it and then gently bring your attention back to the exercise. Generally, this loss of self-awareness as we become hooked by thoughts becomes less, and we become more and more quickly aware of what we are thinking. If you notice you get lost in your thoughts and that you have for a moment forgotten that you are sitting on a bank by the river, notice and let the thoughts land on a leaf that is floating by. There may be many thoughts, hundreds. Just notice them and place them on the leaves, even if they are repetitive, reoccurring thoughts. If a difficult or painful feeling arises, simply acknowledge it and say to yourself, I'm aware of having a feeling of whatever it might be, boredom, impatience, frustration, sadness, fear, anger. Place those thoughts on a leaf too, and just allow them to float along. Just keep placing any thoughts you have on a leaf and simply let it float by. I'm now going to leave you again for a few moments to watch the leaves on the stream and allow you to continue placing your thoughts on the leaves. Remember, the goal is not to eliminate thoughts, but to observe them without judgment. The more and more that you repeat this exercise, the better you will become at recognising and letting go of unhelpful thoughts and diffuse from unhelpful thinking patterns. In a moment, I'm going to ask you to take 3 deep breaths comfortable for you and come back to the present moment. Starting now, as you take your first breath, you're starting to feel more energized and aware of the room around you. With your second breath, you are starting to open your eyes, feeling refreshed and relaxed. And now with your third breath, you are feeling wide awake and back in the room. Good. Good. So during the leaves on the stream exercise, you might have noticed negative thoughts coming in. Hopefully, you're able to place these on a leaf and just let them go. However, we often find that negative automatic thoughts keep popping up until we do something about them. So how do you manage these negative thoughts? Well, the first thing is to capture them and learn what triggers your negative thoughts. Keep a record of the triggers, how the thought made you feel, and learn to be kind to yourself and forgive yourself. Once you've done this, you can then start to challenge your thoughts, rather than just accepting them as 100% true all of the time. So challenge your thoughts. Think about what is the best thing that could happen, the most likely thing, and the worst thing. Check for evidence. Put your thought on trial. What is there evidence that your thinking is true or indeed untrue? Or how can you actually find out if your thoughts are true? Also, consider reframing your thoughts. So, for example, instead of thinking, I am not good enough, try thinking, I am good enough. A few other examples of reframing are included on the screen. So just now looking at unhelpful thinking styles or cognitive distortions as they are often referred. So anxious people often adopt unhelpful thinking styles. So for example, they apply a mental filter based on their own personal experiences and values and tend to only focus on one aspect of a situation, which usually tends to be the negative side, whilst overlooking other aspects, i.e. the positive. So they collect evidence to support the negative point of view, which reinforces the little computer program that runs in the background. They can also adopt all or nothing thinking, so absolute based on extremes, and fail to consider anything in between. Well, very rarely life is like that, so sometimes we do have to consider the bits in the middle. They can also apply emotional reasoning, interpreting their current emotions as fact. Well, as mentioned previously, it feels very real, so therefore it must be true. But just because it feels like it's true doesn't mean to say it is. It's a normal stress response. Catastrophizing is another common distortion, exaggerating the situation and focusing on the negatives. Similarly, magnification and minimization, particularly when comparing self to others, viewing others in a positive light and self negatively. Moving to the right hand side, jumping to conclusions, including mind reading, assuming we know someone else's thoughts or motives. Well, how can we know what others think when we haven't necessarily got a good grasp of what is going on with ourselves? Predictive thinking, overestimating negative emotions and outcomes, and the list goes on. The final one, captures included should and must have statements which are absolutes that anxious people often put on themselves and others, which are often unrealistic and unreasonable. So an example of that could be perfectionism. So by monitoring and analysing our thoughts, we have a chance to do something about them. So back to the serenity prayer and having the courage to change the things you can. You can learn to monitor and manage your thoughts. So why not break the cycle and take back control? Numerous CBT self-help guides are available free online, including through the NHS, should you wish to explore this subject area further, or alternatively, a trained therapist can help guide you too. And finally, as some of you may know, my dad was a bit of a poet and regularly shared his poems on the Facebook page. The poem above was one that he wrote in memory of Alpha friends that passed away and was regularly included in the Alpha newsletter under the In Memoriam section. Rather than read the full poem, I just wanted to draw your attention to the two final sentences. So pause just for a moment, Let your mind take free to take stock. Be thankful in that moment, remembering what you've got. We can't change the past, nor is there any point in worrying about the future. So let's be grateful for what we have today. So, fact. In life, yes, we all face challenges, some of which are outside of our control. But the one thing we do have control of is how we face those challenges, what we think, feel, and do. So take back control today, starting with how you think, and give yourself the chance to live the best possible life you can, free from stress and anxiety. And finally, that's me, Tracey Piper, my contact details, and as mentioned, I am also a member of the Facebook community should you have any queries. Thank you.